Hello everyone. We are now going to go over the peripheral blood flow cytometry plots from a 12-year-old boy who presented with lymphadenopathy and numerous circulating vacuolated large atypical cells. So let's start with CD45 versus site scatter. And here we see a population in the lymphocyte gate that is bright CD45 positive and it has low site scatter. And we have a population in the monocyte gate that has similar CD45 to our lymphocytes, and they have slightly higher site scatter. Our granulocyte gate has 26% cells, and these have very high site scatter and dimmer CD45 than lymphocytes and monocytes. And we do see something here where usually blasts sit, and this is kind of continuous with our lymphocyte population. And right now it's gated along with the lymphocytes, and let's follow through and see what they express. Now here we see that all our cells express CD20 and CD10. So there is no way we can distinguish in this plot whether these cells are sitting here or here, but I would assume that they are here because you don't expect to see a CD10 positive B cell population in the peripheral blood. So these are probably our large atypical cells that we see in the peripheral blood that are 10 and 20 positive, and these are negative for CD34. This is important because our cells are sitting in the blast gate, and CD34 is an immaturity marker, and that is helpful to see that these are not immature. But again, immature B cells can be just TDT positive and not CD34 positive. So this alone is not enough, but this is helpful. And another clue is that the CD20 expression is pretty homogeneous, which happens in the mature B cells. And surface light chains will also help distinguish between the immature B cells and the mature B cells. So if we see here in kappa versus lambda, we see that all the B cells are lambda restricted. We have nothing in kappa. So I think the bright CD45 cells that are negative for CD20 and kappa lambda are probably T cells. But anyways, we have more markers and tubes to tell us what they are. And here our CD10 positive cells are negative for 71 and 34. And in the second tube, which has additional markers like CD5, CD23, and CD200, we see that our 19 positive cells, or the B cells, are the ones that are sitting in the blast gate. And the cells that are here with brighter CD45, they are actually CD5 positive and 90 negative. So like I said, those are T cells. Our B cells are negative for CD5. They are negative for CD23. They have partial FMC7. They're negative for CD200, negative for CD23 and 5 again, and they are all lambda restricted. And they do express CD38, pretty homogeneous. They're negative for the hairy cell marker CD103. So we have a B cell lymphoma, which is lambda restricted. So we would think more in terms of a mature B cell lymphoma here, because it has surface light chains and pretty bright 20, negative for 34. But sometimes immature B cells can also rarely express light chain, and they can be light chain restricted, but that's not very common. So even though we see something like this in peripheral blood, when we get the tissue specimen from these patients, we will always do TDT to just confirm. But from the immunophenotype itself, it looks like this is a mature B cell process. So this is a CD10 positive B cell lymphoma. And this is lambda restricted. And if you see that this bright 10 and 38 expression, that indicates that this is a germinal center B cell process. So in your top line, you'll just say CD10 positive B cell lymphoma or B cell lymphoma from germinal center origin, and you'll give your differential diagnosis for this case. And if you remember that we saw that the atypical lymphocytes were large and had vacuoles in the cytoplasm, and this is a 12-year-old boy. So the final diagnosis on this case turned out to be Burkitt's lymphoma. But again, that's a tissue diagnosis. You don't have to say Burkitt's lymphoma in your flow cytometry report. You just list that as one of your differential diagnoses. And one more thing you have to remember is Burkitt lymphomas are negative for BCL2. Some labs perform BCL2 by flow cytometry. We don't have that here, but if it is added in the panel, it will be usually negative. So that also helps in the diagnosis of Burkitt lymphoma, and you can add that in your report. So this is a CD10 positive mature B-cell lymphoma that turned out to be Burkitt lymphoma. Thank you.